New research shows what was once a way to prevent heart disease and stroke may now cause severe bleeding inside the skull. Reed Binion tells us why the American Heart Association and American College of Cardiology are no longer recommending aspirin regimens for older Americans.
The risks of an aspirin regimen for someone without heart disease may actually outweigh the benefits. Taking a daily low-dose aspirin to help combat heart attacks and stroke might increase your risks of severe bleeding in your brain. In an analysis of past studies of over 130,000 people aged 42 to 74 given a low-dose aspirin or placebo, those who took the placebo had a 0.46% risk of having bleeding inside their skulls. For those who took a low dose of aspirin, the risk was 0.63% of developing bleeding in the brain. People from Asian backgrounds and those with a body mass index under 25 had the highest risk. A low-dose daily aspirin regimen had been recommended for older adults, thanks to aspirin's ability to prevent platelets from forming a clot in the arteries. With this new evidence, aspirin is no longer recommended to prevent heart disease for healthy older adults who don't have a high risk of developing or already have existing heart disease, and may just be a waste of money or worse. It could even raise your risk of internal bleeding or bring on an early death. For today's Health Minute, I'm Reed Binion.
Philadelphia's tax on sugary drinks is driving down sales, but it's not clear if it's having a real impact on health. A year after the tax was imposed, sales fell 38%, but that's taking into account a sales increase in neighboring cities. The American Medical Association supports the tax as a way to combat obesity, but the beverage industry and many merchants have fought back with court cases and ballot initiatives. 7 U.S. cities have passed similar taxes. World health experts have issued new guidelines when it comes to lowering your risk for dementia. They say one of the best things you can do is follow a healthy lifestyle. That means getting plenty of exercise, avoiding smoking, overeating, and too much alcohol. The World Health Organization says there is some evidence showing a Mediterranean-style diet may reduce the risk of cognitive decline. And despite being promoted for brain health, experts say there is no proof that fish oil supplements, vitamins B or E, or activities designed to boost thinking skills actually work. Did you walk or bike to work today? When's the last time you worked out or ate all your veggies? These are all questions that factored into choosing America's fittest city. Sarah Daloff takes a look at the list of the country's fittest cities, and the results may just surprise you.
In the race for fittest city in America, a new winner. Well, really a repeat winner. For the second consecutive year, Arlington, Virginia takes the top spot in the American Fitness Index.
It makes sense. It's a great area to live.
Earning Arlington its place, a balanced blend of community infrastructure and healthy behaviors, like a high number of residents who exercise.
I went to about 7.5 miles.
I've lived here for, 35 years, and there have always been places to run.
The index looks at the largest 100 cities in the country, examining everything from eating habits to aerobic activity to obesity rates. And new this year, categories of air quality, number of pedestrian deaths, and bikeability. Along with Arlington, Seattle, Minneapolis, San Francisco, and Madison, Wisconsin were ranked highest.
All of the top cities were very strong in their community assets for physical activity, such that it is easy to bicycle, to walk, to go to parks.
At the bottom, Indianapolis, Toledo, Tulsa, North Las Vegas, and Oklahoma City. Those findings, experts say, not meant to shame, but to show city leaders where improvements can be made, and hopefully to foster some friendly competition among all cities. Kyle Crabtree is visiting Arlington from California, a state with 7 cities in the top 20.
From California to Arlington, it's on.
Friendly and healthy competition.